So say a patient presents to your emergency room with jaundice, nausea, vomiting, and elevated AST/ALT levels. Considering their history of IV drug abuse and tenderness to palpation in the right upper quadrant, infection with a hepatitis virus is on your differential diagnosis. So doctor, how would you be able to determine which virus they're infected with? Well, serologic markers of hepatitis viruses give us the ability to diagnose the distinct hepatitis viruses. Step 1 wants you to be most familiar with the serology of hepatitis A virus and hepatitis B virus. I can almost guarantee you that you will see a question on your boards about this concept. Before we dive headfirst into hepatitis B, let's warm up discussing the serology of hepatitis A virus. Do you remember what disease is caused or seen in a patient with hepatitis A virus infection? Remember, it causes an acute hepatitis leading to jaundice, nausea, vomiting, right upper quadrant pain, and elevated AST and ALT levels. The serologies of hepatitis A are more simple than hepatitis B because there are only two antibodies that we need to worry about. The two antibodies we look for are the IgM and IgG antibodies. Just remember, these are immunoglobulin antibodies that are produced by our immune cells in response to the invading hepatitis viruses. So if we remember back to immunology, IgM antibodies are the first class of antibodies to be produced by our immune system and are indicative of an acute infection. IgG antibodies are made later after class switching occurs, so their presence indicates a previous infection or a prior immunization. So as a rule of thumb, IgM equals acute infection, while IgG presence in the blood is indicative of a past infection or a history of immunization. So with this in mind, what would the presence of IgM antibody against hepatitis A virus represent? It would tell us that the patient has an active hepatitis A infection. Therefore, the presence of immunoglobulin G or IgG antibodies against hepatitis A virus is indicative of a prior hepatitis A infection or vaccination against the hepatitis A virus. Now we're going to talk about the serologic markers used in the diagnosis of hepatitis B virus. Classically, this is a more difficult concept to understand for many students. The principles that we just discussed about antibodies and antigens hold true here for hepatitis B, but it is more difficult because there are more antigens, antibodies, and disease states to account for. So to best review this, we're going to start by talking about the different antigens and antibodies. We're going to go through the graph showing the levels of these antibodies and antigens during various courses of infection. And then finally, we're going to go through some examples of how all of this information is put together and tested. So here's an image of a hepatitis B virus particle. This image is illustrating the important structural components. There are three important antigens to know when discussing the serologies of hepatitis B. We need to know about the hepatitis B surface antigen, denoted HBsAg, the hepatitis B core antigen, denoted HBcAg, and then there is the hepatitis E antigen, denoted HBeAg. We can see here that the coat protein is on the coat of the virin, and we can see the core protein is in the core of the virin. These antigens are found on the surface or inside the virus, like I just said, and in response to this infection, our immune system produces antibodies against these three antigens, including anti-hepatitis B surface antigen, anti-hepatitis B core antigen, and anti-hepatitis B-E. These are all immunoglobulins that we can measure in our bloodstream and give us an idea of how or if our body is successfully fighting the infection. Important to note is that we cannot measure the core antigen in the bloodstream, but we can measure the antibodies to the core antigen, and we can distinguish them if they are IgG or IgM. And this will give us an idea if the hepatitis B virus infection is either chronic or in acute stages. Now let's go through the serologic markers one by one and discuss their significance. Like we just mentioned, hepatitis B antigen is the surface antigen found on the hepatitis B virus. There are not many things that are black or white in medicine, but if the surface antigen is measured in the patient's blood, this patient has an acute or chronic active hepatitis B infection, period. I want to make this really clear. If you see on your test that there is a positive HB surface antigen, the answer will either be chronic or acute infection. You can immediately rule out recovered infection or previously immunized as answer choices if they have the surface antigen in their serum. It is important to know that you cannot determine whether the patient has an acute or chronic infection by this antigen alone. We will rely on the presence of other antibodies to tell us that. But what is important is that the hepatitis B surface antigen tells us that there is active hepatitis B that is either chronic or acute. Now, if you were to measure the antibodies against the hepatitis B surface antigen, then you can say that the patient has developed immunity to the hepatitis B virus. This immunity can either be developed because the patient had a hepatitis B infection in the past that is now resolved, or it can be that the patient has been previously vaccinated or immunized. Next, we look at the hepatitis B core antigen, the antigen that is found inside the core of the virus. Like I mentioned earlier, we cannot detect the core antigen in the blood serum, but we are able to detect the IgG or IgM antibodies against the antigen. So using your thinking caps, what would you think the patient has if there is measurable IgM antibodies against the hepatitis B core antigen? IgM antibodies would indicate that there is an acute infection, while IgG antibodies would indicate resolved infection or a chronic infection. Very good. It is important to know, and this is a very important concept, that we will not see antibodies against the core antigen in response to vaccination. And why is that the case? Well, it's because the hepatitis B vaccine is a subunit vaccine that is exclusively the hepatitis B surface antigen. Therefore, in response to this vaccine, our body only produces antibodies against the surface antigen only. Finally, the E antigen, or what I like to call the excited antigen, correlates with how infective the virus is. If the E antigen is positive in the patient's serum, the virus is excited, it is actively replicating, and it is highly transmissible. Now, if there are antibodies to the hepatitis B E antigen, the virus is not excited and has low transmissibility. Here's the most important image to know for our discussion of the hepatitis B serologies. This graph depicts the levels or titers of the antigens and antibodies on the y-axis in relation to the months after exposure on the x-axis. It is important to know that this graph depicts the normal and healthy response to hepatitis B infection, ultimately resulting in a disease-free state. So now let's go through the graph together. Initially, within 1 month of exposure, the hepatitis B surface antigen begins to rise. This is followed by an increase in the hepatitis B E antigen as well. Do you remember what the surface antigen stands for? This stands for active infection. And how about the hepatitis B E antigen? That stands for high transmissibility. Very good. Within 2 months after exposure, antibodies against the core antigen begin to rise as the levels of the surface and E antigen begin to fall. Do you think these antibodies against the core antigen are going to be IgM or IgG antibodies? These will be IgM antibodies initially because these are the antibodies that are initially produced by our immune system. So these changes we are now describing are significant of our immune system starting to take hold on fighting the infection. So now at this time here, 3 months, would you say that this patient has an active or resolved infection? Even though the body is starting to produce antibodies to the core antigen, the patient still has an active hepatitis B infection. And the reason is because there's still the surface antigen present. Remember that the hepatitis B surface antigen is indicative of an active infection. Do not let the presence of this antibody to the core antigen fool you in thinking that this is a resolved infection. As long as the hepatitis B surface antigen is present in the serum, the patient still has an active infection. Between 5 to 6 months within exposure, the hepatitis B surface antigen sinks to undetectable levels before antibodies against the surface antigen are produced. This period, where there is no antibody or antigen detectable against the surface antigen, is known as the window period. During this window period, the only measurable antibody or antigen is the antibody to the core antigen. So we can remember this by remembering that we see through the window. The window period comes to an end when antibodies to the surface antigen are produced. At this time, when you find antibodies to the surface antigen, you can confidently say that the infection has resolved and the patient is in recovery. So now at 8 months post-exposure, the patient has detectable levels of antibodies against the surface antigen, the excited antigen or the E antigen, as well as the core antigen. Would these antibodies to the core antigen likely be IgG or IgM? At this point, it's likely that they would be IgG antibodies. So when we see antibodies to all 3 antigens, we can all rejoice and safely say that our patient has recovered from hepatitis B infection. Now let's review everything we just talked about in the table that illustrates which serologic markers are present during the different stages of infection or immunization. It is important to know the different stages of infection the patient can be in. The patient can either be found to have an acute infection, be in the window period, have a chronic infection with either high or low transmissibility, be recovering or recovered from an infection, or finally, they can be immunized. So you can look at these options as your different answer choices. On the test, they will give you the markers and expect you to discern which of these 6 stages the patient is in. So now for a fun learning exercise. I have mixed up this table found in your book, and we're going to go over them one by one and fill in the table together. So starting with the first row, we see our patient has this serologic signature. What stage of disease do you think this patient is in? Go ahead and pause the video, think about it for a second, and come up with an answer. We will go through it together just a moment. So we know the patient is recovering from an infection or has recovered from a past infection. And how do we know? Well, the first thing I look at when I'm doing these problems is if the surface antigen is present or not. Why? Because the surface antigen tells me if the patient has an active infection or not. Remember, if there is no surface antigen, I know that the patient does not have an active infection. However, when does this rule not hold true? During the window period, because in the window period, there is no surface antigen, but there is also no surface antibody. So this is kind of the gray area between infection and recovery. But back to our first example. I know that the person is recovering or has recovered from a hepatitis infection because the antibodies to all 3 antigens, the surface antigen, E antigen, and C antigen, are present in the serum. Now, what stage of infection is this patient in? Acute, chronic, recovery, or immunized? So what is the first thing we want to look at in these problems? We want to look at the hepatitis B surface antigen. Very good. So in this patient, it is present. So right away, we know that this patient has an active hepatitis B infection. So the next question you ask yourself, is it chronic or acute infection? So how do you determine that? Well, then we would look at the type of antibody present against the core antigen. In this case, we see that it is an IgM antibody. So what does this patient have? This patient has an acute hepatitis B infection. Very good. And what does the positive hepatitis E antigen represent? It means that the virus is highly transmissible. Very good. All right, how about this patient? We can see here that the surface antigen is positive, so there is an active infection. We know that right off the bat. We then look at the antibody to the hepatitis B core antigen to figure out if this is a chronic or acute infection. So we can see that this is an IgG against the core antigen, which lets us know that this is a chronic hepatitis B infection. Very good. The next thing we need to figure out is the virus highly or lowly transmissible. Since the excited antigen is present, or the E antigen is present, we know that the virus is highly transmissible and infective. Very good. How about in this next patient? So as you can see, there's not much found in the serum, just antibodies to the core antigen and the E antigen. Do you remember what this period is called? This is called the window period. Very good. The patient is in that gray area where there is no surface antigen and no surface antibody, and therefore we're close to resolving the infection, but we haven't resolved it just yet. So how about this one? So we know right off the bat that this patient has an active infection with an IgG antibody against the core antigen, so we know that this is a chronic infection. And how transmissible is it? Well, we can see the presence of the antibody against the excited antigen tells us that this is a poorly transmissible chronic hepatitis B infection. So now let's take a look at the final patient. Can you tell me what this patient has? Well, we can see that all he has, or she has, is the antibody against the surface antigen. Without antibodies against the core antigen, we know that this patient has never had an active hepatitis B infection. So this is a serologic signature for a patient who is priorly immunized. So that's all. I would recommend looking over this approach more and get it down in your head. On step 1, the concepts will be the same, but sometimes they can present the material in tricky ways. The better you know the basics, the better you'll be able to successfully figure out the tricky versions you might see on test day. Now time for a flash quiz. In the window period of the hepatitis B infection, what serologic marker would you find on your hepatitis panel? We would see antibodies against the hepatitis B core antigen. Remember, hepatitis B core antigen helps us see through the window. In this period of the infection, there is no more hepatitis B surface antigen found in the blood, and the body hasn't quite formed enough antibodies against the hepatitis B surface antigen. Therefore, the only thing we see in the bloodstream is antibodies to the hepatitis B core antigen.